Did you know 230 million people each week ask ChatGPT a health-related question? Today, we are going to be looking at AI in medicine and whether it's here for good or for evil. The foundation of this poster is drawn upon Dr. Robert Pearl, the former CEO of the Permanente Medical Group, and his opinion piece that was published to LinkedIn in February 2026. In his opinion piece, Dr. Pearl equates AI in medicine as to the analogy of crossing the Rubicon, a reference to Roman history when Julius Caesar defied the Roman Senate and brought his armies across the Rubicon River. It essentially means a point of no return. Dr. Pearl is unequivocally saying that AI in medicine is here already and is changing the foundations of medical practice. In his opinion piece, he gives examples of how AI is already radically changing the clinical side of medicine, between large hospital systems implementing AI screenings, to big tech launching AI health, to states moving away from clinicians' oversight on AI and decision making. But before I launch into his examples, I wanted to first discuss the pros and cons of AI in medicine. So, is AI for good? Very possibly. We see that AI has improved, but not replaced clinical care. For example, a study at Cedars-Sinai showed that AI diagnoses rated optimal in 77% of cases versus 67% of cases for physicians for physicians. In a different study, Open Evidence scored a 3.75 out of 4 across relevance across 5 chronic disease states. AI has also enabled continuous chronic disease management, as it can offer real-time 24/7 monitoring of hypertension, diabetes, and hopefully this can prevent countless heart attacks, strokes, and kidney failures in the future. Finally, AI frees up clinicians' times so they can focus on higher complexity work. When a clinician isn't bogged down by repetitive clinical tasks on a daily basis, that same clinician can now focus on the most complex patients, or even expand their scope of practice into specialty territory. While all these positives do seem good, what about the flip side? What about the evil? Is AI for evil? Also possible. AI at this point is unregulated and ethically fraught. For example, patient data privacy is at risk. There's no national encryption protocol that exists for AI in healthcare. Also, in the age of AI, clinicians who routinely defer to AI may lose diagnostic independence. What if in the future clinicians are forced to consult AI before making a diagnostic decision or a treatment plan? Finally, AI does not have accountability. So who's liable when AI makes a clinical error? The larger health system, the AI technology company, the reviewing provider? There's no national legal framework for AI errors that exists at this point. Now that we have discussed the good and the evil aspects of AI, let's bring it back in to talk about what Dr. Pearl's examples were of AI in medicine crossing the Rubicon. Well, Mass General Brigham is using AI as a diagnostician, meaning it's forming diagnoses and treatment plans before the physician even steps into the room. Cedars-Sinai and Mayo Clinic report using AI as for intake and triage of patients, which leads back to our previous topic when we mentioned AI matching and exceeding clinical diagnoses. Then we also have big tech in AI, such as OpenAI's ChatGPT or Anthropic's Claude, coming out with applications that track and monitor wearable health data, such as the ones on your watch, on your smartwatch, or to interpret at-home point-of-care testing, such as a blood pressure reading or a glucose reading and what that means. Then finally, the future of AI may not even require a doctor's supervision. For example, here in Utah, we have a pilot program that allows AI to renew chronic prescriptions without the oversight of a clinician. Now, while this might sound great to reduce provider task burden, what do we do if there's an error? We will see. In conclusion, AI in medicine is here to stay. As a society, we have crossed the Rubicon with AI in medicine. And while AI is extremely promising and seems to be helpful and has positive patient visions, AI remains unregulated at this time, and it poses data breachment risks and liability risks to both patient and provider. So in conclusion, we must ensure that AI's integration into medicine is guided by equity, accountability, and an unwavering commitment to patient safety. Thank you.